what happens in the mouth has detrimental consequences in the rest of the body. And the other way around, if you treat all the diseases in the mouth, this can have a positive impact on the rest of the body as well.
So did you find in your research any insights around kind of how age can differentiate the severity of certain gum diseases?
The more you age, the more you're likely to have gum disease. Why is that? Because the damage in terms of gum disease is cumulative over time.
What have kind of been the traditional ways that you would treat people that come to you at different stages of gum disease?
The treatment of gum disease always starts, interestingly enough, with taking care of the risk factors. So not only plaque accumulation, actually educating the patient on how to brush effectively.
Crystal, welcome to the podcast.
Hello, nice to meet you. Good to finally be here.
Yeah, no, for sure. I'm really excited about today. We're going to really dig deep into learning a bit about your expertise on gum health, on dentistry. We can talk about periodontology. And when I was doing a little bit of research in preparation for this podcast today, I was reading about the connection, the systemic connection between gum health and certain gum diseases and how it can really impact people's lives in areas such as I'm reading about cardiovascular issues, diabetes, and other ailments similar to that. And also in the US, I was reading about how I think over 50% of people, you're going to be able to let me know if that's correct or not. Maybe it's a vague stat, or actually have some kind of gum disease, but they overlook it, or they're not sure about it.
It's
welcome to the podcast. Really excited to have you. And maybe we can start with just a little bit about your background, your medical background, and your journey in dentistry so far.
Cool. So first of all, I'm a dentist by training, and I'm also a researcher and academic. So I split my time between clinical work and also teaching and doing research. So I'm trying to do a little bit of all these three things, and I limit and I focus both my clinical practice as well as my clinical research on periodontology. So meaning the study, investigation, and the treatment of all gum-related conditions.
Wow. Yeah. So just that. There's a lot going on there. Super interesting. You're at the Harley Studio Dental
Harley
Studio?
Street Dental Studio.
Harley Street Dental Studio right now.
I do my clinical work in Harley Street.
Yeah.
Harley Street Dental Studio, and then I do my teaching mainly at the University of Siena, which is my alma mater in Italy.
Yeah.
As well as my research activity split in between Italy and the UK.
And again, whilst I was doing some research on you actually in preparation, I was seeing a lot of the awards that you've won. Just to kind of go through a couple, but the Goldman Prize in best basic research in the Italian Society of Periodontology.
Wow, you started.
Which I thought was amazing. And I think the list was super long, and I was like, okay, I'm talking to the right person when it comes to dentistry and oral health and how it can impact wellness. So a really specific area I think maybe we can start off with is just exploring the link between kind of gum disease and oral health. Maybe we can call it oral health and systemic wellness or systemic health, however you want to look at it. Just kind of like digging into a little bit around why that's so important today for people.
Okay, so let's say that the connection, the idea, first of all, that the mouth wasn't completely, let's say, detached from the rest of your body is actually not that new, because it dates back to the late 1800s, early 1900s, if that makes sense. So let's say that the idea that the mouth was somehow connected to the rest of the body dates back to more than 1 century ago. Then from theory to practice, there has been quite a long way, if that makes sense. So the idea that the mouth is actually connected to the rest of the body is that what happens in the mouth has a consequence on the rest of the body. So if your mouth is not healthy, so if you have, for example, gum disease, or if you have cavities, or if you have a lot of granulomas, what we would call apical periodontitis, let's say from a more scientific and dental point of view. Yes, this is not just limited to your mouth, because most people think as like, oh yeah, I'm totally fine. I mean, I don't even care about their oral health because they think it's like something that's completely detached from the rest of the body. But actually what happens in the mouth has detrimental consequences in the rest of the body. And the other way around, if you treat all the diseases in the mouth, this can have a positive impact on the rest of the body as well. So this kind of field within periodontology, so within, let's say, the gum health point of view, it's called periodontal medicine. Okay, so that part of medicine that highlights and somehow studies and investigates the connection between your gums, which is most of your mouth, let's say, and general health, so other diseases affecting your body. Why is it important? Because again, they are not detached. There's like a bi-directional relationship between what happens to your body and what happens in your mouth.
Wow, that's incredible. And I guess many people don't really understand that. And I feel when it comes to looking after, your actual oral hygiene and your gums and your teeth, we all go to the dentist every few months maybe, and you kind of listen to them, and some people, they do implement the things that they're told, and some people don't implement the things. And so in terms of where you see the issues arising from to start with, so we know that there's an issue there for a lot of people. Is there certain lifestyle things that are going on and diet related issues that people not looking after certain areas that are affecting their gum health?
So let's say that when we talk about gum disease, which it is also actually called periodontitis, it is actually a chronic inflammatory disease. We usually make the comparison between gum disease and diabetes, because most patients and the wider public is more familiar, if you think about it, with diabetes, but it's quite less familiar with gum disease. So gum disease has a lot of risk factors, okay? So a lot of factors that can increase the risk of having gum disease, if that makes sense. That's how we define a risk factor. And in terms of risk factor, of course, we've got the main risk factors, which is basically the plaque accumulation, the buildup around your teeth. But then there's a big series of other risk factors that go way beyond your mouth in terms of gum disease. First of all, if you have other systemic conditions, these will increase the risk of you developing gum disease, including diabetes, diseases affecting your lungs, or metabolic diseases as well. And then we've got a new field, which together with my team in Italy and also partly in the UK, we have researched quite a lot about. Actually, all my PhD project was about lifestyles and gum disease. We've, let's say, implemented and we've done all this research about how specific lifestyles can increase the risk of developing gum disease. Which kind of lifestyles? In particular, poor nutrition, poor diet quality. My research was performed mainly with clinical trials done in Italy, so it's mainly focused on Mediterranean diet and how if your diet is not really adherent to a Mediterranean diet, you're more at risk of having severe types of gum disease. High stress, poor sleep quality, excessively long or excessively short sleep duration, as well as, of course, the consumption of smoking and cigarette and also alcohol consumption, all these kind of lifestyles, they can have an impact. But the main thing is that it's not only one of these lifestyles that has an impact, but all these lifestyles are somehow linked together, right? In psychology, when you're trying to change a habit, where you're trying to induce somehow a behavioral change in a patient, you don't just change one lifestyle. You've never heard of somebody following a perfectly healthy diet, but then not even going out for a walk, if that makes sense.
Or smoking every day.
Or smoking every day. Or you've never heard of someone who's highly stressed, but has a perfectly 8-hour sleep nights, right? So it's all about detecting these lifestyles and not only treating gum disease, but also try and improve and trigger these kind of positive lifestyle changes that can, first of all, decrease the severity of gum disease themselves, but can also decrease the risk and the onset and improve the management of other conditions like diabetes, hypertension, cardiovascular diseases, etc.
Wow, no, there's a lot there. And you mentioned that, what I picked up on there was a lot, but especially around people that actually sleep too long, there could be an issue there. So on that kind of if we go down that wave, was there any surprising insights that come to fruition when you were doing your research in this particular area that you thought, wow, actually that's super interesting, and I wouldn't have thought that was the case?
Yeah, well, it was quite interesting because I've always been one of those people sleeping 4 or 5 hours per night, and I thought that my problem was just having just too short kind of sleep night. But in terms of interesting findings is that there's a sweet spot.
Right.
And the sweet spot in terms of number of hours of sleep per night actually depends on your age. So if you're an adult up until you're 60, your sweet spot is sleeping 7 to 9 hours per day, while if you're older, 7 to 8 hours per day is actually fine. Okay. Anything that's shorter or longer is more associated, let's say, increases the risk of being associated with metabolic diseases and inflammatory diseases in general. Diabetes is an inflammatory disease, but also gum disease is an inflammatory disease. So it's not about just sleep as much as you can, but it is actually about how the sweet spot in terms of number of hours.
Yeah, and is there any impact on kind of like age as well, and age of the person? You know, did you research around that? Obviously, you think about things like dementia and Alzheimer's, and what I think about is a lot more of an older demographic.
Yeah.
But then you think about what I know about gum disease from my little bit of research I've done before here is that it can get to a point where, you know, around the age of 50 or middle age, and things start to get a bit worse as you get older. So did you find in your research any insights around kind of how age can differentiate the severity of certain gum diseases?
Yes, for sure there is a relationship between the prevalence, meaning how many cases of gum disease you have around the population, and gum disease in general. What does it mean? It means that as you age, you're more likely to develop gum disease. Why is that? So there's a peak of incidence, so a peak of new cases of gum disease, which is around 37 years old. Okay. But then again, the more you age, the more you're likely to have gum disease. Why is that? Because the damage in terms of gum disease is cumulative over time. Most of the times gum disease starts when you're like probably 28, 29, 30s, and it starts from very, very early signs of gum disease, okay? That most of the times they go undetected. So what happens is that at some point it just gets discovered, and the older you are, the more likely you are to develop to have actually gum disease. What's the difference though? The difference is that it's in terms of susceptibility. Whenever we have a very young patient with very severe disease phenotype, it's very different than when we have a patient who's 70 with a very, very severe disease phenotype, okay? Because it means that the 30-year-old guy with a stage 4, meaning the most advanced case of gum disease, is way more susceptible and is at risk of losing all the teeth because of gum disease at a very early age. While if a patient reached 70 years old with all the teeth in the mouth and has gum disease, of course, we need to treat it. But in terms of susceptibility, what we know is that maybe that patient was actually less susceptible, if that makes sense.
Yeah, no, 100%. Yeah. So yeah, it really depends on the case, on the age, on the severity, and at what stage you actually come to you with these issues and let you know about it. And
exactly.
Do you find that there was, from your research, was there a particular demographic or type of person that was having more issues than other people were?
Yeah, sometimes in my practice, I've seen very, very young patients when I like 26, 27. And these patients usually attend the practice because they want cosmetic work, right? They want cosmetic teeth, they want whiter teeth, they want this brighter, wider Hollywood smile, which is amazing. But a very beautiful smile is actually a combination between the pink and the white. Well, my colleagues take care of the white, I take care of the pink. And the most important thing, also whenever you do cosmetic work and you've got a very young patient with actually a health concern, a disease underlying, is that you make sure that you convey the message that you can have beautiful aesthetic smile only if you've got good foundations, right?
Yeah.
So that's why you need very healthy gums. And that's the most difficult part about my job. When you've got very healthy patient, we've got a very young patient with gum disease, they just want cosmetic work. So the most difficult bit is like, okay, we need to delay the cosmetic work because first of all, we need to get you back to health and make sure that you don't lose your teeth by the time you're 40 or by the time you're 50, if that makes sense.
Yeah.
It happens sometimes. And these patients are usually, they have some familiarity, some family history because of gum disease. And somehow sometimes they also have other conditions. They may have pre-diabetes, for example, or they can have other skin inflammatory diseases that tend to be quite common among the young population. And somehow they've just been to the dentist, sometimes either for just regular checkups or once every few years, or they're less health conscious because they're just too young, right? And when you're like 25, 26, 27, you're not that much health conscious as when you're like 60.
No, yeah, exactly.
That's quite normal.
Yeah. You care more about the looks, I guess, than what's going to be like 30 years from now.
You just want whiter teeth.
Yeah. So what would you say to people of that age today that see all these influencers that are going over to Turkey, or they're going to get their teeth done in, maybe the States or in Europe somewhere because maybe it's a bit cheaper, and, that maybe actually they're not in the best state to be doing that? Is there any advice you'd actually give to them, to maybe preempt not having any further issues in the future if they decided they wanted to do that?
Well, that sometimes what looks cheaper in the short term is actually ends up being way more expensive in the long term. Because what happens with this work and with dental tourism in general, sometimes, of course, they just do cosmetic work and any underlying condition, for example, gum disease, is not actually treated. So you don't see the problems within 3 months, but you start to see the first problems within the first 6 months, right? And then at that point, you're in the UK or you're in Australia or you're in the US, and you find yourself with a whole lot of issues in your mouth, and it will cost double or triple in order to get it fixed. So it is way better to take care of your health first and make sure that any cosmetic work that you do is actually long lasting. So this is what you want to do in order to actually save money down the line.
100%. Yeah, that's good advice, and I think a lot of people hopefully will watch this and take that advice from you. So I guess if we're moving then into like thinking about treatments for people that are having these issues when it comes to issues of gum health, what have kind of been the traditional ways that you would treat people that come to you at different stages of gum disease in the past? And then is there any interesting advancements in the technology or things that are coming up at the moment or next few years to be able to help people that have got issues in the space?
Well, in terms of treating gum disease, let's say that we have got guidelines from the European Federation of Periodontology and the American Academy of Periodontology in order to know how to treat gum disease, okay? But of course, we've got a few steps, let's say formally, but everything starts with a consultation. So we never head straight to treatment. Because again, most of the times I see patients because they get referred from one of my colleagues or from the dental hygienist because a patient has gum disease. And that's the result of a screening procedure, right? It's binary. It's either you have gum disease or you don't have gum disease. And then when they come to see me, I make the full diagnosis with radiographs. I take a lot of pictures. I take additional clinical information. And then from there, I know how severe gum disease, okay? In general, the treatment of gum disease always starts, interestingly enough, with taking care of the risk factors. So not only plaque accumulation, actually educating the patient on how to brush effectively or how to effectively take care of the teeth and gums. And then is actually doing the treatment, which is what sometimes it's commonly called deep cleaning, but this is what we scientifically call subgingival instrumentation. So we go under the gum line and we remove the plaque, calculus, and bacteria, okay? And then we let the gums heal for roughly 8 to 10 weeks. That's what's the core chunk of treatment of gum disease, what we would now also call the non-surgical treatment of gum disease. So the actual recent advances in how we treat gum disease compared to the past are mainly two. First of all, we try and solve most of the cases of gum disease without surgery. Okay, in the past, especially in the 80s and in the 90s, the main core of treatment of gum disease was quite invasive. And it didn't revolve around changing the patient habits. It was more about doing surgery to just remove what's the consequence of a disease, the destruction, the loss of bone caused by the disease. At the minute, we're trying to do the same, but without any surgery. Okay, so it is something that is way less invasive. But the main advancement, and also something that we're gonna see a massive change in the next 5 to 10 years, is a more holistic care in terms of gum disease. What we know from the research is that lifestyles, for example, have a massive impact on gum disease. So when we do what we call the step 1 for the treatment of gum disease, we already have guidelines set in place in order to do some kind of smoking cessation chat with the patient, right? Because we know that smoking is one of the main risk factors for gum disease. So the goal is to implement also other lifestyle advice, nutritional, physical activity, stress, sleep related, or everything, all things like that, okay? There's a document actually published by the NHS England, which is called Make Every Contact Count. And of course, there's a different intensity in terms of lifestyle interventions that we can have. And in the dental practice, we can do mainly 2 things. And this is what has to be implemented on a larger scale, which is either we signpost all of our patients to useful websites where there are very useful lifestyle advice, Or, for example, we can give ourselves some tips in terms of how to improve your diet quality or how to have at least a bit of regular physical exercise on a daily basis. So it is literally not only treating the disease, but treating the patient as a whole. That's the massive shift in perspective, right, as a dentist that we have. Because as dentists, most of the times, we are taught and we're just focused on getting the treatment done. But here it's different because we're talking about managing the disease from a risk factor perspective.
Yeah, and it's really interesting. I mean, do you see that patients that you kind of give this advice to, they'll come in, they'll say, oh, it's my gums are swollen or they've got gingivitis or certain issues. And then you're telling them, 1 minute, what's your diet like? What's your lifestyle like? A lot of people are surprised at that you actually are kind of then saying, cool, we can, look at the teeth, but this is coming from something systemic that you're doing or something in your lifestyle that needs to change. Are people surprised at that when you kind of have these conversations with them? Or is it like, does it make sense to people?
Let's say that it depends a lot on the person, especially within the younger generation. There has been a massive shift in perspective, okay? Because there's a lot more information now with a lot more articles also about free sugars and their impact on cavities, for example. But actually free sugars have a detrimental impact on gum health as well. So usually there's a conversation that starts with supplements because there's a big market now around supplements. But it's a good way to kickstart a conversation about nutrition. Because whenever you take a supplement, you can take vitamin C, but you can decide to take that kind of micro or macronutrient either with a supplement or by implementing the consumption of specific foods in your diet. So it depends on the generation. This is what I noticed. But the most important thing is to start slowly. And then whenever you see the patient, you just dig deeper. If that makes sense. So that the patient gets accustomed to this kind of new way of treating, of managing actually the disease, which is not only doing the active treatment, but actually sitting, having a conversation and make sure that your patient actually understand the causes of the disease and the kind of treatment of management of the diseases that you're delivering.
Yeah, no, for sure. And in terms of the diet specifically, I don't want to spend too much time on it, but you mentioned free sugar, I think there, and how that has a detrimental effect. Obviously, carbohydrates, they kind of, they turn into sugar or, in terms of the way that it works. But would you say that, free sugars, carbohydrates, these are the main issues because if people aren't looking after their oral hygiene, they're not brushing, they're not flossing, they're not, I don't know if tongue scraping something, I do that, but I don't know if that's something that you recommend. Is that something that you see is a big issue when it comes to the diet because a lot of the bacteria remains underneath the gum line, or is it generally another way to look at that?
So it's a combination of two factors, as always with lifestyles. There's a direct effect of free sugars on inflammation.
Right.
Okay, so free sugars just increase inflammation, both at a local level, so increasing, for example, gum bleeding, but also at a systemic level. So it increases also the general inflammation in your body. And then there's the indirect effect, which is something that I also hinted at earlier, which is if a patient really consumes a lot of free sugars or a lot of carbonated beverages, for example, it is highly likely that their lifestyle is not super healthy. So it means that also their domiciliary oral hygiene habits are not, let's say, very, very effective. Okay, so it's about linking how healthy and unhealthy lifestyles actually, they go hand in hand. Okay, so it's always with lifestyles, they're very difficult to study because there's always a direct biological effect and an indirect kind of effect that we need to take into account.
Yeah. It's funny how the body just wants to realign, doesn't it? All these things are mixed together, they're all related together, but we all look at, we look at specific issues sometimes and we're like, oh, we've got a problem with this and that, but it really just comes back down to just having a balanced body, right? And just kind of things work together. And what would you recommend then is the ideal time frame that people should be coming to dentists and maybe even hygienists to make sure they're keeping on top of this? Is there a particular time frame that you think is perfect for that?
So I'd say it depends on your risk profile, as usual. Right. So, of course, whenever you come first and see the dentist first time, the dentist will just advise you on your risk profile. So if you're, for example, in a high risk profile, either for gum disease or from a cavities or from a caries point of view, you might also be advised to see the hygienist every 3 months, if that makes sense. While in some other cases, it's also okay to see the general dentist every 6 months and then see the hygienist every 6 or 12 months. But it really, really depends on your risk profile. But in order to know that, you need to see your dentist first, and then your general dentist would be able to advise. So there's no one size fits all with regards to this.
Yeah, no, for sure. Okay, cool. And one thing I wanted to run past you as well is there's a lot of viral dental hacks that are going out there at the moment, which I'm sure probably some of your colleagues might look at and questionably ask, okay, is that something that people actually try? And I wanted to see if you had an opinion on some of them.
Okay,
if you knew about any of them, you might not as well, and to see what, if you had any opinions.
Them, so.
For sure, I know, but it might be really, it's a bit like a myth busting, isn't it? For people to think, oh, wow, I'm gonna... so one that I've been seeing a lot of, I've got a couple notes here, is coconut oil pulling. Is there any science behind that? Is that something that you've seen to work? I don't know.
Let's say that that's a viral trend.
Okay.
So I'm honest, I've scrolled past it. Let's say that in terms of studies and the trials behind it, there's actually no evidence that that works in reducing either gum inflammation or bad breath, for example, or reducing the caries risk. There is some evidence with regards to general health as to how coconut oil can somehow reduce general inflammation, but then again, it's very limited evidence. And it is not strictly related to oral health. So in terms of recommending it instead of other ingredients that are, let's say, more widely tested, I would absolutely, let's say, recommend it, because again, there's not enough science behind it for us to recommend it.
Yeah, for sure. Okay, noted on that one.
Sorry.
And then I guess we can talk about like toothpaste generally. I think charcoal toothpaste has been something I've been seeing around for a few years, and people using charcoal in different products, to be fair. But I guess charcoal toothpaste and toothpastes generally, what would you suggest is ones to focus on and the best ones for looking after gums?
So there's a lot of misinformation about toothpaste as well. Starting from the charcoal toothpaste, again, it went viral, I think, a while ago, but I don't know whether it's still viral at the minute. At the same time, it went viral just because of its whitening effects, I think, right?
Yeah,
Correct. Yeah. So basically, there are some studies that have tried somehow to investigate the effectiveness, first of all, in terms of whitening, of removing stains or whitening effect of this kind of toothpaste, and also in terms of the side effects of charcoal. While some studies have highlighted that there can be some good, let's say, staining removal potential, which is different than whitening, but that's more of a technical comment. There are a lot of side effects with using charcoal, which is the biggest one. It is that it is very, very abrasive. So it basically wears away the enamel, the nice whitish shell of your teeth. So it is absolutely not recommended as a whitening toothpaste. In terms of toothpaste, again, there's a lot of myth. And in the past, we used to say, all toothpaste are the same. I recently published an article about this. Why is that? Because again, there are a lot of ingredients in the market, not only a lot of brands, but a lot of active ingredients in the market for toothpaste. And what we've tried to do in this article was to mainly try and make a little bit of order, meaning that we listed the main ingredients in the market, and then what we did, we tried and checked the quality and the amount of evidence for each of these ingredients and for each of the oral conditions, so gum health, caries, whitening activity, reducing bad breath, and all this kind of stuff. So what we tried to create was some clinical guidelines for clinicians in order to choose what's the best toothpaste for every condition. So for example, for whitening, with, let's say, stain removal, we've got baking soda. Actually, it's the best ingredient in order to whiten your teeth.
That's also a viral trend, though.
That's also a viral trend,
I'm
though.
sure,
but there's a specific toothpaste that contains baking soda. Okay.
Nice.
Specific toothpaste that contains, which is actually sodium bicarbonate.
Interesting.
And it's very good for your gums. It was found to be quite good for your caries prevention, and it was also found to be quite good in terms of reducing the stain, so stain removal. So you can have a look. We've got a table, and there are specific guidelines for every condition.
I can link that underneath the video, actually.
Absolutely.
In the description.
It is quite helpful for clinicians, for patients, but also because in the market you can find a lot of things. Some of these things are actually tested, and we know that they're quite good for specific conditions. And also in terms of fluoride is still good to prevent caries. Although I know now there's a good movement, let's say, there's a movement against fluoride. But again, in terms of guidelines, depending on every age group, there's a certain amount of fluoride intake that you need to have. So that's the
and
current.
I was going to mention the last one I actually had on here was about teeth whitening, and the most popular one I've been seeing is actually teeth whitening strips, which they look like a bit of a fad and something, I don't know, like, but is that something again that is it actually can be like could become an issue when it comes to the enamel on your actual teeth, or are they okay?
Yeah, absolutely. They can absolutely wear away. They're very, very abrasive as well. Not quite effective. So basically you're almost causing a damage to your teeth without having, let's say, the cosmetic benefits that you're hoping for. But in terms of whitening, what we know that, let's say, the most effective way to whiten your teeth with the least health damage to your teeth is actually going to the dentist. The dentist will assess if you have any cavities, any gum problems, any health problems, and then actually the most effective way to whiten your teeth is with a at-home whitening. Okay, so your dentist will fit some trays. Okay, will customize some trays, something like clear aligners to your teeth, and then the dentist will prescribe the right amount of whitening gel, and basically you can just wear these guards, these clear aligners at night, and then that's the best way actually that you have to whiten your teeth.
And if people don't look after their gums and they don't do kind of the initial work to make sure that their teeth and gums are in good stead, but they do the teeth whitening, what issues could come if they're not in good shape already before they start doing the whitening?
Well, for sure, especially if you're applying too much whitening gel inside the trays, you can increase the risk of having gum bleeding or gum swelling, or especially sore gums. So that's why it is essential before you do any whitening procedure that your dentist is the one prescribing the whitening, because again, the dentist at that point has checked whether you have gum disease or any kind of gum conditions that you need to take care of first before you actually undergo the whitening.
Yeah. Okay, cool. I'll keep that one locked away somewhere in case in the future I decide I want to get onto that. Okay, cool. And I think also an interesting area that might be good to talk about is actually, we've spoken a little bit about how we can actually help patients, but it might be interesting to talk about your experience on how we can help general practitioners or other dentists speak to their patients in a better way when it comes to giving them better advice, maybe. Like what you're seeing in terms of practices or ways that you think you'd be able to better educate dentists or health practitioners that are maybe trying to find better advice in this day and age to help their patients.
So let's say that it's a tricky one because again, the dental work is mainly related to when you actually do the treatment. Of course, a massive shift in perspective, especially if you want to do periodontology and you want to treat a chronic disease like gum disease, is that you actually need to find the time to see with your patient and just chat with them first, right? So first of all, you need to have the patient trust you in terms of the patient opening up to you and saying, oh, that's my lifestyle. You know what? I'm not actually going out for a walk. My life is quite sedentary. And then at that point, you can start giving lifestyle advice. There are a lot of, let's say, techniques in psychology, especially also, for example, all the motivational interview bit of things. So a lot of techniques can help you. But of course, the best and the quickest way is to actually, first of all, establish a rapport with the patient, right? The patient has to trust you first, and then you can actually ask the questions, because otherwise they tend to be quite personal questions, if that makes sense.
Yeah.
So you risk having, let's say, the opposite effect, and the patient is saying, oh, why is the dentist asking me about my smoking habit or about whatever? So first of all, you need to develop a rapport with the patient, right? Because our job is very, very intimate, right? It's very, very intimate.
Yeah, no, for sure. That's super interesting. And I feel it sounds like, dentists and health practitioners, they need to start looking at things more holistically in a way, and being able to not just look at the specific issue that's going on, but like we were speaking about earlier, just generally having awareness around how things affect different areas of the body. If we're talking about kind of trends moving forward then into kind of the next few years, is there any interesting trends that you're noticing in the field of dentistry, maybe periodontology generally as well, that could be, maybe from a research, it could be interesting to highlight?
Yeah, so if we talk about the management of gum disease itself, of course, the massive trend that I'm seeing is that we should focus less on treatment, but more on prevention. So we should focus less on treating the disease, but taking care of how to maintain a state of well-being, right? When we're in 2025, so we have to be able to prevent the disease or to treat the disease while it is at its very, very early stages. So the main focus of research in the past was about treatment, and now there's a lot of research in terms of how can we actually understand who are those patients, those very, very young patients, the 17, 18-year-olds, 19-year-olds patients that we see at the practice, who are among those patients that are going to develop the advanced cases of gum disease. That's what we want to focus the research on, because we want to identify them and then make sure that they don't lose teeth because of gum disease, if that makes sense. But that's the most difficult part of the job. So understanding who among those is actually the ones that are going to develop the severe phenotype of the disease. The other trend and the other interesting bit of research, and that I've started recently, is the connection between skin diseases and gum diseases.
Wow.
So that's the newest bit in terms of the oral systemic health that I've been working on. That was supposed to be part of my research project during my PhD, and now I've been continuing it so far, and it has quite promising results.
Yeah. Is there anything you can talk about yet, or is it something we need to?
It's already been published.
It's been published out there. Okay, cool. We're going to have a long list in the description now of some interesting studies from you. It's been great having you on today.
Cool.
And thank you for your time. Where can people catch you in terms of like online? Is there any place that you prefer them to reach out for any questions or anything like that?
So I've got my Instagram account, and also, I see my patients at Harley Street Dental Studio. So Instagram or ResearchGate or LinkedIn as well.
Okay, amazing. Great. I'll put it in the description, and great having you on today.
Cool. Thank you so much. Thank you.